Shock is a critical medical condition. It occurs when the body's tissues don't receive enough oxygen-rich blood. This lack of oxygen can lead to organ damage. In severe cases, shock can be fatal. It's a medical emergency requiring immediate attention. Recognizing and managing shock is paramount in healthcare. Medical students must grasp the complexities of shock. This understanding is crucial for their future practice. Shock can manifest in various medical scenarios. These include trauma, severe infections, and heart conditions. Recognizing the early signs of shock is vital. Early intervention can prevent organ damage and improve survival rates. Medical students must be prepared to manage shock. They need to know how to stabilize patients. There are 4 main types of shock: hypovolemic, cardiogenic, distributive, and obstructive. Each type has distinct characteristics and causes. Hypovolemic shock results from significant blood or fluid loss. Cardiogenic shock occurs when the heart can't pump enough blood. Distributive shock happens when blood vessels dilate excessively. Obstructive shock occurs when there's a blockage in the circulatory system. While the underlying causes differ, the symptoms of shock share similarities. Recognizing these symptoms is crucial for prompt intervention. Symptoms include rapid, weak pulse, low blood pressure, rapid, shallow breathing, cold, clammy skin, altered mental state, decreased urine output, and cyanosis. These symptoms arise from the body's attempts to compensate for reduced oxygen supply. Untreated shock can lead to organ failure and death. Section 5. Unraveling the pathophysiology of shock. A breakdown. Shock involves a cascade of events at the cellular level. Inadequate oxygen supply disrupts cellular metabolism. This leads to a shift from aerobic to anaerobic metabolism. Anaerobic metabolism produces lactic acid. Lactic acid buildup contributes to cellular dysfunction. As shock progresses, cells become damaged and leaky. This releases inflammatory mediators into the bloodstream. These mediators exacerbate the inflammatory response. This can lead to multiple organ dysfunction syndrome, or MODS. Section 6. Diagnostic approaches. Identifying shock. Diagnosing shock involves clinical assessment, patient history, and lab tests. Recognize characteristic symptoms and assess vital signs. Check heart rate, blood pressure, and respiratory rate. Medical history provides valuable clues. Lab tests confirm diagnosis and determine the cause. Initial treatment steps for shock. Immediate action is needed to restore oxygen delivery to tissues. Ensure airway patency and adequate breathing with supplemental oxygen or mechanical ventilation. Administer intravenous fluids to increase blood volume. Identify and treat the underlying cause, such as surgery or antibiotics. Monitor vital signs and urine output to assess treatment effectiveness. Section 8. The importance of early recognition and management of shock. Shock is a life-threatening condition that requires immediate attention. Early recognition and management are crucial for improving patient outcomes. Medical students must possess a strong understanding of the different types of shock, their causes, symptoms, and treatment approaches. By mastering these concepts, they can play a vital role in recognizing and managing shock effectively, ultimately saving lives. Remember, time is of the essence when it comes to shock. Every minute counts in preventing irreversible organ damage and ensuring patient survival.